Question first for Dr. Massé. I just wanted to know your opinion on the use of plexiglass barriers in classrooms, given the nature of aerosol transmission. Do you think they're effective and should be installed?
This is a quite interesting and difficult issue. I've seen classes in Asia mostly where there have been some plexiglass that were put between students, but at the same time as they were putting plexiglass, they were kind of putting the students very close one to the others. So I'd rather have a distanciation of 2 meters if we can respect that rather than make any barriers between the students. In some instance, there's been also barriers between the teacher and the students, and we know that other than in class, it occurs that people are using that, and it's effective. But in terms of teaching, there are other side problems of using them. This is why we recommend masks, and I must recall that we are recommending procedure masks, which are not kind of facial covering tissue, which is really something which has a higher standard of quality, and this is why we increased the level of protection to the children in secondary schools. And it applies to the teacher, which already had a recommendation of using those procedure masks, which are kind of what we call surgical mask, if you want. So we think that this is something which should be effective rather than putting barriers in plastic between the children. As I said, what I've seen, I'm not saying it's not effective. I'm saying that it has other sides problem that we would not want to happen in our classes.